The other story that's dominated the news and your lives for more than 6 weeks now, there are more than 38,000 confirmed cases of COVID-19 in Canada and more than 1,800 deaths. The number of new cases varies widely depending on the region, and Ontario and Quebec have the biggest numbers. In Ontario, more than 11,000 people are known to have COVID-19, a jump of 551, and more than 600 people have died. Quebec has more than 20,000 confirmed cases, a rise of 807, and 102 more people died there, bringing the number of dead in Quebec to more than 1,000. That is the most of any province, and the majority of those who died, 850, were in long-term care homes or other senior residences. Staffing in those facilities has been hit hard too. Quebec said today about 1 in 5 positive cases are healthcare workers. Mike Armstrong explains the huge toll that's putting on the system.
Going into this crisis, experts knew long-term care facilities were vulnerable, but COVID-19 got to them anyway. Well, the professional orders representing Quebec doctors, nurses, and auxiliary nurses announced Tuesday a joint investigation into what went wrong.
Alors, est-ce que c'est l'information qui a été mal donnée?
The head of the auxiliary nurses says they want to know whether it was a question of training or equipment shortages or something else that let the virus in. What's happened has been devastating. In Quebec, 300 long-term care facilities have had at least one case. The outbreaks in 80 are still not under control. One of those facilities has now had a first healthcare worker die. Vicky Salvant worked as an orderly at the Grace Dart Centre for 25 years. Her last shift was April 11th. She died of COVID-19 just 6 days later. It was a reminder to everyone the work being done in these facilities can be dangerous.
I think about it every day.
Quebec's healthcare minister says she's well aware of the danger and the toll it's taking. In a province with just over 20,000 COVID-19 cases, about 1 in 5 is a healthcare worker. In some areas around Montreal, the ratio's even higher. Between positive tests, preventative leave, burnout, and anxiety, about 6,000 healthcare workers are off the job. For the ones still working, there's frustration as supplies of protective gear are only starting to fill the demand.
We're playing catch up, and obviously our members, all of them, are asking questions about this type of thing.
More and more of the government's focus is now targeting long-term care facilities. One plan that's just started is to move healthcare workers from other parts of the province to hard-hit areas like Montreal. They'll be put up in hotels and dedicated to one facility for 2 weeks. Mike Armstrong, Global News, Montreal.
A worker has died from COVID-19 and hundreds more are sick after an outbreak forced a meatpacking plant to close in southern Alberta. The Cargill meatpacking plant employs more than 2,000 people. It's now the largest outbreak in Alberta. A woman in her 60s who worked there died, and more than 480 cases are connected to the facility. 360 workers are known to be infected. Many other positive cases are connected to carpooling and other living arrangements between the employees. The Prime Minister confirmed today that 2 planes, one chartered by the federal government, the other by an unnamed province, flew to China to pick up personal protection equipment for frontline healthcare workers in Canada, but came back empty.
There are severe restrictions on the ground in China in terms of how long a plane can actually stay in their airports before having to leave, whether it's full or not. And at the same time, supply lines and truck shipments to the airports are difficult and interrupted by checkpoints and quarantine measures. For the most part, we've been able to navigate through those and ensure that Canada has received the equipment that it needs, but these 2 airplanes were forced to take off empty.
Canada's largest airline is suspending all scheduled flights to and from the United States starting on Sunday. Air Canada says it made the decision after the 2 countries agreed to extend border restrictions for another 30 days. The company hopes to resume flights on May 22nd, but that depends on further government restrictions. Air Canada has reduced scheduled flights by more than 90%, but it was still running flights to 11 U.S. destinations to help repatriate Canadians. Those will all stop on April 26th.
There's so much information surrounding coronavirus out there now. We know you have questions. Email your questions at globalnews.ca. Tune in to Global National or go to globalnews.ca/coronavirus now to find the answers.